been rising for about a month now, since late June. Over the past 7 days, we are reporting 233 new cases daily, which is a 63% increase over last week. The number of new cases has quadrupled since June the 28th, when we were seeing 55 cases a day. That represents a 300% increase. Incidence rates have increased across all age groups, with the sharpest increase among residents less than 50 years of age. And we're seeing the highest rate of new cases among the age groups with the lowest vaccination rates. On the 26th of July, our 7-day incidence rate is 72 per 100,000, which is up from 19 per 100,000 on June the 29th. And we are in the middle of the CDC's substantial community transmission rate range. Our incidence rates have been rising across all regions of the county and in all racial and ethnic groups. Now, the good news is that in contrast to sharply rising case numbers, hospitalizations are holding steady this week compared to last, with about 30 to 40 people hospitalized per week recently. And this represents a new hospitalization in King County about every 4 to 5.5 hours. Most recent hospitalization numbers are 1.9 per 100,000 over 7 days on the 18th of July, compared with 2 per 100,000 over 7 days on the 7th of July. So that incidence rate is very stable, and that's good news. On the other hand, we have to keep in mind our hospitalization rate lags a few weeks behind increases in cases, but I believe that we're seeing the tremendous benefits from our vaccination program protecting our older adults who are at highest risk for hospitalization. And it's really important to understand that when looking at these hospitalization rates and their relative stability compared to case rates, that's likely because 88% of King County residents 50 and older are fully vaccinated. And that's a phenomenal proportion of residents who are at highest risk for hospitalization who are getting protection. Additional great news is we've recorded no new deaths over the past 7 days. And this is down from an average of 10 deaths a day just before we initiated our vaccination program. Also, excellent protection from the vaccines. Now, I want to just say a word about the variants of concern, Delta variant in particular. The Delta has thrown the world a nasty curveball, and it's changed the course of the pandemic from where we had hoped to be today in the US. Because people infected with the Delta variant produce 1,000 times more virus, it's much more contagious than earlier variants, which means that people get infected easier and faster and are more likely to spread the virus to others. Reports also suggest Delta infections can cause more severe illness among unvaccinated adults. And even though our vaccines continue to provide a high level of protection against serious infections from the Delta variant, Delta can cause breakthrough infections among a small proportion of vaccinated people. It's important to understand that most breakthrough infections that are reported are seen in a minority of vaccinated people and are relatively mild, but they can lead to spread from vaccinated people to others. And that's one reason mask wearing is recommended for everyone in indoor public spaces at this time. I'll speak more about this in a minute. Now, the Delta variant currently represents 78% of sequenced cases in King County for the most recent 14-day period, but that data are a few weeks old, and it's likely representing a higher proportion today. So when you're exposed to COVID-19 in King County today, it's most likely you're being exposed to the Delta variant. And again, I want to be clear that our vaccines offer excellent protection against Delta, but the complete series is required. So if you want to be protected, and you should, remember, it takes 5 to 6 weeks after the first dose for full protection, and both doses are necessary. So I want to just address a couple of common questions we've been getting recently about the Delta variant. One is, how soon after exposure to the Delta variant do symptoms appear? Well, with the Alpha variant, or the most common virus that was prevalent before Delta emerged, it was 5 to 6 days after exposure when symptoms typically appeared. It appears to be a bit shorter with Delta, perhaps 3 or 4 days. And so patients become contagious more quickly after exposure and can spread to others more rapidly. Another question we're getting is, does the Delta variant have different symptoms? And there have also been reports of more people complaining of runny nose, sneezing, congestion, headache, sore throat, and fever with the Delta variant than with the Alpha, although this information is not well standardized yet, and full descriptions of symptoms comparing Delta to previous variants have not been published. I think in general, most of the symptoms overlap, but Delta does appear to have a higher proportion of people reporting runny nose, sneezing, congestion, and sore throat. Headache, fever, muscle aches, weakness, difficulty breathing are common to all variants. What are the symptoms of Delta variant? Just went over that. How dangerous is the Delta variant for children? There are no data indicating the severity of illness in children is different for the Delta variant compared with earlier variants. And the most important question is, do vaccines work against Delta? And the answer is unequivocally yes. Although there might be a slight drop-off in protection, vaccines offer excellent protection against Delta, particularly against serious infections, hospitalization, and death. And if you aren't vaccinated, you're at high risk of becoming infected and spreading infection to others. Now, I want to just speak a bit about outbreaks, and we're going to publish a blog next week with some details about a few recent outbreak investigations our team has been working on. But our recent outbreaks really are highlighting the risk of COVID-19 transmission in settings where groups of people have prolonged indoor contact. These outbreaks, like others reported nationally, include settings where both unvaccinated people, people with unknown vaccination status, and vaccinated people were together and not wearing masks, and instances of infection even in vaccinated people engaging in indoor activity in a poorly ventilated space without masks, where the vast majority were vaccinated. So for example, our team has been working on an outbreak associated with an indoor fitness center in Seattle. On July 6th, we were notified of 6 people who tested positive for SARS-CoV-2 who recently spent time at an indoor fitness center. This facility had recently hosted a Pride charity workout event on June the 26th with 70 people in attendance, and that included members, staff, and non-members. The facility voluntarily closed when we contacted them and has been cooperating with the investigation. And as of the 28th of July, we've identified 16 cases among fitness center attendees and one household member of an attendee. And these cases had illness onsets occurring as recently as the 7th of July. And the ages of these cases range from 26 to 59 years of age. 14 of 16 were verified to be fully vaccinated, and 2 additional cases reported being fully vaccinated, but were not verified. All 16 cases developed symptoms of COVID-19, but none were hospitalized. Some reported their symptoms to be very mild. And at least 5 cases have had sequencing results indicating the infection is due to the Delta variant. Now, this outbreak appears to be over. There have been no new cases reported since July 7th associated with this facility. When our team did an on-site visit to the facility, we found several factors that could promote COVID-19 transmission, including a ventilation system that did not allow adequate airflow. Bathroom exhaust fans were not functional. Physical distancing was not consistently maintained among members when they were in attendance. And this is a place where people typically spend a couple of hours, so a relatively prolonged period. There was a strong encouragement by the management to vaccinate for the members, and members provided verbal verification of vaccination, although vaccination status was not formally verified. And the owner reported facial covering and masks were not required for fully vaccinated members or staff in accordance with the CDC guidelines at that time, and they were not commonly worn. So this is an example of the type of venue where even vaccinated people need to take precautions. Indoors, prolonged period of exposure, poor ventilation, and activity that increases the risk of COVID transmission being vigorous aerobic exercise. So again, we'll have more information about several other outbreaks that our team is investigating posted on our blog next week. Now, I want to pivot and talk a little bit about vaccines because we've got good news on the vaccine front. 81% of our King County residents aged 12 years and older have received at least one. Now, that said, again, we still have approximately 680,000 King County residents who remain unvaccinated, and this includes about 370,000 who are eligible for vaccination and not vaccinated, and over 300,000 children less than 12 years of age who are not currently eligible. And all of these residents remain at risk for contracting COVID-19 and in fact, at increased risk compared to earlier in the pandemic due to the emergence of COVID-19. Now, we are seeing a little uptick in the number of people seeking doses, which is great. We've had 1,500 people receiving a first dose in the last 24 hours alone, which is on par with one of our highest volume days in July. So it's very gratifying to see people beginning to seek vaccination right now in the context of the COVID surge, and we encourage folks to continue to do that. I'll say a few words now about breakthrough infections again. You know, as more people are vaccinated, we are hearing more and more about these so-called breakthrough infections among vaccinated people. And this discussion can be a bit confusing. Breakthrough cases for any vaccine are a normal and expected phenomenon as more people are vaccinated. We know vaccines are not 100% protective. No vaccines are. The main purpose of these vaccines is to prevent serious infections, not any infections, not mild infections. So calling mild or asymptomatic cases breakthrough cases is a bit misleading in that these are less serious infections and are not what the vaccine is really intended to prevent. The truth is that the COVID-19 vaccines are among the most effective vaccines ever made. For example, over the past 30 days in King County, 81% of our cases are not fully vaccinated. 89% of our hospitalizations are not fully vaccinated, and 91% of our COVID-related deaths are not fully vaccinated. And another way of looking at this is that during this time period, residents who are not fully vaccinated were 10 times more likely to test positive for COVID-19, 15 times more likely to be hospitalized for COVID-19, and 12 times more likely to die due to COVID-19 related illness. And finally, just looking at the overall risk, there were about 1,450,000 people in King County fully vaccinated as of July 16th. And there have been 1,489 cases reported among fully vaccinated people. That is 0.1% of the fully vaccinated. With respect to hospitalizations among fully vaccinated, the number is 62, which is 1/100th of 1%. So less than 1/100th of 1% of those fully vaccinated. And with respect to deaths, there have been 11 reported among the fully vaccinated, which is less than 1/1000th of 1% among the fully vaccinated. So breakthrough infections do occur. They occur very rarely in the context of the total number of people who are vaccinated and are receiving excellent protection from these vaccines. Now, that said, it's also important to know that not everyone responds equally well to vaccination, and some people have lower protection than others. When we talk about vaccine effectiveness, we're talking about population figures, but that's an average of lots of individuals. So this is especially an issue for certain people who are immunocompromised and possibly older adults who have underlying health conditions that put them at increased risk. And for this reason, these groups should continue to take additional precautions to decrease their risk from COVID-19. The bottom line is that the vast majority of COVID-19 cases, hospitalizations, and deaths occur in unvaccinated people. Our vaccines are incredibly effective, especially against serious illnesses and hospitalizations, and make it much less likely, although not impossible, that a person will catch and transmit COVID-19. And vaccination is the single most important thing you can do to protect yourself and to protect those around you. Now, I want to say a few words about the mask guidance. Last week, I shared our guidance for everyone, regardless of vaccination status, to wear masks in indoor public spaces. And this recommendation is intended for spaces where the vaccination status of others is unknown, like restaurants, grocery stores, gyms, retail, and entertainment venues that are open to the general public. Since that time, the CDC also released similar guidance recommending masking for both unvaccinated and vaccinated people in indoor public spaces. And in regions like King County and others where COVID transmission is at substantial or high levels. And as I mentioned earlier, we are currently at a substantial level of transmission and on an upswing trend currently. Now, when all people, regardless of vaccination status, wear masks in indoor public settings as an extra layer of protection to help us all stay safer, our unvaccinated adults and the 300,000 children in King County who aren't able to get vaccinated yet, and the many thousands of people who have immune systems that are weakened or suppressed, and to a lesser extent, even vaccinated persons benefit. Masking in public spaces is also beneficial for those who are in close contact with someone at increased risk and to model mask wearing for children. And it also can help protect from other respiratory illnesses and allergens. I'm going to move on now to remind everyone that in addition to masking, it's critical that I take this opportunity again to stress the importance of improving indoor air quality, airflow, ventilation, and filtration whenever possible for reducing the risk of COVID-19 indoors. COVID-19 is transmitted through the air. It builds up in closed spaces as infected people breathe, and the risk increases where people are singing, shouting, or exercising, and with longer periods of contact. Windows and doors should be opened whenever possible to maximize the movement of air. Building and business owners should evaluate their HVAC systems to increase outside airflow. They should upgrade filtration when possible and consider the need for portable HEPA filtration units. And as always, gathering outside when with unvaccinated people is the safest. I also want to emphasize COVID testing remains a vital strategy for limiting the spread of the virus in our community. And COVID-19 testing guidance has recently been updated so that anyone with signs or symptoms of COVID-19 should get tested as early as possible, regardless of vaccination status. This includes even mild symptoms. In addition, whether you're vaccinated or not, if you've been around someone who has a suspected or confirmed case of COVID-19, you should get tested after your exposure within 3 to 5 days and possibly even sooner, given the predominance of Delta, even if you don't have symptoms. And if you test negative, you should continue to monitor for symptoms for 14 days following exposure. And if you develop symptoms, isolate yourself immediately and be retested. If you test positive for COVID-19, even if you have mild or no symptoms, and even if you're fully vaccinated, you should isolate yourself away from others for 10 days. Now I'm going to speak a bit about the recent multiple healthcare professional organizations that came out in support of mandatory healthcare worker vaccinations as a condition of employment. There is a multi-society statement on COVID-19 vaccination as a condition of employment for healthcare personnel from the Society for Healthcare Epidemiology of America, the Society for Post-Acute and Long-Term Care Medicine, the Association for Professionals in Epidemiology and Infection Control, the HIV Medicine Association, the Infectious Diseases Society of America, the Pediatric Infectious Diseases Society, and the Society of Infectious Diseases Pharmacists, recommending that COVID-19 vaccination should be a condition of employment for all healthcare personnel. There's another multi-society statement signed by 31 national professional organizations, including the American Medical Association and the American College of Physicians and the American College of Nursing, the American Academy of Nursing. That also calls for all healthcare and long-term care employers to require their employees to be vaccinated against COVID-19. The American Hospital Association came out with a policy statement urging the vaccination of all healthcare personnel and supporting hospitals and health systems that adopt mandatory COVID-19 vaccination policies. And the American Nurses Association supports healthcare employers mandating nurses and all healthcare personnel to get vaccinated against COVID-19 in alignment with current recommendations for immunization by public health officials. So today I want to state that Public Health Seattle-King County endorses these statements that represent a wide range of medical, nursing, hospital, public health, and other health professional societies and organizations recommending mandatory COVID-19 vaccinations for healthcare personnel. And we strongly encourage healthcare facilities in King County to follow these recommendations. Vaccination of healthcare personnel against COVID-19 increases the safety of the vaccinated healthcare workers, of their patients, their families, their coworkers, and the community at large. With that, I think I'll pause and leave time for question and answers, and I welcome a discussion with you.
Thank you so much, Dr. Duchin. And a reminder to media who are part of the briefing, please use the raise your hand function in Zoom and we'll call on you. First up is Mayor Grewal from Worth a Shot.
Hi, Dr. Duchin. Again, I'm Mayor Grewal from Worth a Shot. And my question is, I know that the Department of Health and the American Academy of Pediatrics have both recommended masking for kids in school in the fall. Are there any recommendations in particular for the younger kids who are unvaccinated?
Thank you, Mayor. Yes, the state recently came out with their guidance for return to school consistent with the American Academy and American Academy of Pediatrics in the CDC. For younger children under 5 years of age, the current Washington State Secretary of Health guidance, which we endorse and also recommend, is for children between 2 and 5 to wear a mask under the supervision of an adult whenever possible.
Thank you, Dr. Duchin.
Next question is from Allison Grande.
Dr. Duchin, 2 questions if I can. We're hearing from that CDC memo about how the Delta variant could be as contagious as chickenpox, but what does that mean? Where does Delta fall? Measles, chickenpox, Ebola. Can you kind of give us a ranking?
Yeah, thank you, Allison. The media reports are a little bit confusing because I understand that people don't really know what that means. I mean, how contagious is Ebola? Ebola is not an airborne disease. Influenza, chickenpox, pertussis, measles. The bottom line is that COVID-19 is highly contagious through the air. Chickenpox is highly contagious through the air. They're both highly contagious airborne diseases. And that's what people need to understand, that this virus travels very easily from one person to next through the air. And in particular, when you're in an airspace with someone that is not well ventilated, where there are multiple people who particularly are unvaccinated, and where people are doing things like loud speaking, singing, and exercising, these all increase the amount of virus in the air. So, the real takeaway here is that this is a highly contagious airborne virus, that our vaccines are incredibly protective. But even so, when not all of us are vaccinated, we all should take precautions. None of us want to get sick, even if the infection isn't going to be a severe one. We may pass it to others. And there are many people who remain vulnerable because they're not able to generate a strong immune response, those with immunocompromised, and some people who have other underlying diseases and take medications that impair their ability to respond well to the vaccine. So I don't think, the strict, ranking of one disease versus another is that informative or helpful. I think the take-home point is COVID-19 right now is almost all Delta virus. Delta virus is much more infective than the previous viruses of COVID-19 the previous variants of COVID-19 that were circulating, and that wearing a well-fitting and well-constructed face mask or respirator is a way to protect people who remain vulnerable. So those who are immunocompromised or have underlying medical conditions or who are worried about transmitting to others certainly need to mask. But in particular, we all need to mask now to prevent the spread of this highly contagious virus when we're in indoor closed air spaces and we don't know everyone is vaccinated around us.
The rest of my question is, sorry, go ahead.
A second question?
I did, if it's all right. Thank you. Sorry for interrupting. You seem to be ahead of the curve when it comes to guidance, Dr. Duchin. So, you kind of were ahead of what the CDC came up with. So at this point, what is your feeling about a mask mandate in our state, statewide, to clarify confusion, to just order it for a while till Delta dies down?
Well, I can really only speak to the jurisdiction that I'm responsible for in King County, and my fellow health officers in the Puget Sound region have also, provided their guidance, which is the same, that we believe that indoor masking is important and will provide an extra layer of protection for all of us. Whether or not, a statewide mandate would add anything to that, I really can't say. I think that, it makes sense for everybody to be masking up indoors right now, unless you're in a community where there's a low level of COVID-19 transmission. But I think I would let those public health authorities that are responsible for the communities outside of King County sort of weigh in with respect to what they think is best for their community. I mean, we know masking works. We know it will prevent transmission of COVID-19. The best way to achieve widespread masking, I think, is something that may vary slightly from one community to the next.
Next question is from Jessamine McIntyre.
Hi, Dr. Duchin. Thank you so much for your time. Very much appreciated. I wanted to go back to the Delta. Obviously, that's the hot topic of today. Now, we know that it can transmit from a vaccinated person to unvaccinated people, but is there a chain of events where it can jump from a vaccinated person to another vaccinated person until it hits an unvaccinated person? Or is the vaccine protective enough to prevent that chain of events from happening?
Yeah, so we're still learning. Obviously, this is all rapidly evolving information about how Delta is impacting, the level of protection we're getting from our vaccines. It is clear that in a minority of cases, Delta can infect vaccinated people, and those people tend to get less severe illness, but they seem to carry quite a lot of virus in their nose and perhaps throat. Which means that they can pose a risk to others. Now, vaccinated people are at lower risk for getting infected. So the risk of infection spreading among vaccinated people is lower than it is among unvaccinated people. But the extent to which vaccinated to vaccinated transmission occurs, I don't think is well characterized yet. I would assume that it's going to be rather low, but it's probably not zero. But I can't really say with any more detail, precisely how common or uncommon that might be. I think we need to study this and learn from what's actually happening, and not assume too much one way or the other at this point.
Thank you, Doctor.
All right. Next question is from Pablo Gaviria with Univision. He wasn't able to join us today, but emailed in a question. Univision's question is, are we past the point where further mandatory restrictions on businesses and the public are necessary? And if not, what would it take for you to call for them?
Yeah, thank you, Pablo. I certainly hope so. Again, I am right now reassured by the firewall that our level of vaccination among the older adults seems to have provided us in at least so far, avoiding a spike in hospitalizations. And as you see, our death rate has remained very low, which is excellent. But as I've said many times, it's very hard to predict the future with respect to a new, unprecedented emerging pathogen and the pandemic that we have not previously experienced. So I think we need to be very careful about predicting, the future. Now, the Delta variant's definitely thrown us a real challenge in respect to transmissibility and number of infections that it's causing, and the damage that it's causing to unvaccinated people and communities. It's not probably the last variant of concern that we will see. And it's hard to know at this point, what the future holds with respect to types of viruses that may emerge, the severity of illness they may cause, and how well our vaccines will protect against them. Another unknown right now is, although our vaccines are holding up very well with respect to protection against serious illness, there is evidence that antibody levels are decreasing over time. And there may be a point where those levels decrease such that a booster dose will be necessary. So the bottom line is, with respect to whether mandates may be needed, that's all predicated on or depends upon how severely the virus is impacting the health of our community. And if we don't see high levels of serious illness, hospitalizations, and deaths, I do not anticipate or envision a return to mandates. I think that the level of restriction and the number of precautions that we take really need to be based on the severity of illness and the extent of transmission that we're seeing in the community. And so at this point, I think, given the level of vaccination that we have, and I think the increasing vaccinations that we're seeing in the community, the good protection we're getting from the vaccines, and the relatively stable level of hospitalizations, that we would not need further restrictive mandates. But again, much remains unpredictable about the course of these outbreaks, and I would say nothing is impossible.
Thank you. Next question is from Michael Crow.
Hey, Dr. Duchin, thanks as always for doing these. Appreciate your insight on this stuff. Two questions for you. One is kind of piggybacking off of Allison's question, and I just want to make sure I understood. In terms of the evolving situation on Delta transmissibility and research, we were talking about this last week, that it was kind of leading you to talk about a mask recommendation. I know there are, like she asked about a mandate. I guess, are you saying that you just haven't seen enough change to think that a mandate might be necessary, or whether, a mandate just doesn't get more adherence versus a recommendation? And then I also just wanted to ask you, a lot of employers have started to return to their buildings over the summer, right? A lot of people have started reopening plans. Does your guidance change in light of these recent developments on distancing in the workplace, if it's possible?
Okay, thanks. Yeah, so let me help try and clarify around the vaccine business and the mandates and the recommendations. In King County, I previously issued directives, and these are not mandates in the sense that they're not enforceable through punitive actions or fines or penalties. And we have achieved a great level of disease control in the county through voluntary cooperation with recommendations and guidance. And so I'm hoping that we'll continue to see that level of cooperation with the recommendations among our community members and our businesses. I know that many of our business owners and our leaders are very supportive of these recommendations. Everyone wants to keep their customers and their workers as healthy as possible. I am not right now in favor of imposing penalties. I think that, in public health, we want to, whenever possible, use the least restrictive and non-punitive measures to achieve our public health goals. And with the level of disease that we're seeing in the county today, I do not believe any more restrictive or coercive guidance is necessary. I do think that it's important that everybody understands that voluntary compliance has worked in the past, and we depend upon one another to protect both our individual and our community health. And by everyone wearing masks indoors when you're around others whose vaccination status is unknown, we will together improve our individual personal health and the health of our community. And I am confident that our community will understand that and comply with that and to an extent that will allow us to benefit greatly. If we see, again, something unanticipated with respect to hospitalizations and deaths, indicating a severe threat to either individual health, population health, or our healthcare system's ability to function, we may need to consider additional measures or mandates. But at this point, I think that is not necessary. With respect to the businesses getting back together, I think the current guidance is still good. Pay careful attention to the vaccination status of your employees. Understand that masks are an important layer of protection when vaccination status is either unknown or people are not fully vaccinated. I'll speak about this again in my closing, but other strategies to further decrease risk include physical distancing and avoiding crowded airspaces. But I think really the ventilation and vaccination are the two most important measures, and as businesses and workplaces pay close attention to that, and particularly do whatever they can to ensure the fact that their workforce is vaccinated. Everyone who's eligible who doesn't have a medical contraindication is vaccinated. They will have safe workplaces.
Thank you. I'm now going to take a question from a community member on Facebook. So she asks what public health recommendations are for children who are going back to in-person learning. If a child has just a runny nose, should they get tested? Should they be isolated or quarantining?
Yeah, I will. I have to admit, I did not yet read the new Washington State Department of Health guidance for return to school that came out a few days ago. But I would be surprised if guidance on this point had changed. Children who have symptoms should not be going to school at this point. They should be tested for COVID-19. And then follow the guidance about when return to school is safe. And typically that would be after symptoms resolve, if it's a non-COVID illness, or after 10 days from their testing, if it is a COVID illness. But at this point, both children and adults who have symptoms should not be around others and should be tested for COVID-19.
Thank you. Next question is from Kate Walters.
Thank you, Dr. Duchin, as always, for your time. I wanted to ask about booster shots and follow up on some of the things you mentioned last week. I just wanted to clarify, when you mentioned the possibility of people getting these shots from providers, even though it's not authorized yet, is that something that you have had reported to public health, or was that just sort of a hypothetical? And then also, if booster shots do become available, what are the lessons learned from the first rollout of vaccines that could be taken forward into making sure there's equitable access to booster shots if and when those become something that's necessary?
Thanks, Kate. So with respect to booster shots in general, last week I was providing information based on recommendations that people were making in social media that people should seek booster shots. We haven't had complaints per se, or formal reports of people, calling in to tell us they've received booster shots, and I don't think we've detected any third doses in our monitoring of vaccination status. But we do know that some healthcare providers have recommended this, even though it is in violation of both the FDA and the ACIP's guidance and instructions on for the use of the vaccine, and actually jeopardizes the ability of the provider to participate in the vaccination program. So I know that the ACIP is, ready to evaluate the potential need for booster shots, and in particular, a third dose for high-risk populations like immunocompromised patients, as soon as the FDA provides a regulatory or authorizes a path forward for that to happen. With respect to what we've learned, we, as I am always happy to share, we are one of the most highly vaccinated counties in the country. As a matter of fact, I think we are the most highly vaccinated of any county of comparable size in the U.S. That's serving us very well during this COVID surge. I mean, you can see what's going on in other parts of the country with healthcare facilities being overwhelmed. Our most vulnerable people who are at highest risk for hospitalization and death are highly protected. And the majority of cases are occurring now in people who are at lower, but lower risk for hospitalization and severe outcomes. And again, long COVID is a real consideration. It doesn't get reflected in the hospitalization figures, but many of the people who are infected with COVID who don't require hospitalization still can have significant illnesses with chronic sequelae complications that last for weeks to months. So we were very successful so far in achieving our overall population goals, but as you know, we still lag to some degree by approximately 20 percentage points between Black, Hispanic, and white residents, for example. 10 to 20, but that gap is closing over time, which is excellent. We're immunizing more people in the groups that have lower coverage every day. And we've established both great partnerships with community-based organizations and with healthcare providers that have facilitated access to vaccine in those communities that are hard to reach, have had the highest impact of COVID-19, and have been most challenging to vaccinate. And we would basically pick up where we left off with those relationships. And, we're continuing to work in those communities now to get people vaccinated, as many people as possible in those communities who are lagging in vaccination coverage. So I think, we would be building on the strategies that have worked for us so far, and, the efforts that we're engaging in currently, we will reinvigorate, and we would have to consider whether or not we would need to open up, those high throughput vaccination venues again, or whether or not we could alternatively rely on the healthcare system relatively more this time, because more healthcare providers are now providing COVID-19 vaccine. It's more accessible at more places throughout the community.
Great, thank you. Next question is from Nicole Jennings.
Good morning, Dr. Duchin. I'm wondering, we've seen some European countries imposing restrictions on those who are unvaccinated instead of those who are vaccinated. At what point might we see something similar happening here, and what sorts of restrictions might we see for the unvaccinated?
Well, I think the main thing that you're seeing are the so-called vaccine passports, or, venues restricting attendance or participation to vaccinated persons. And I think that, businesses and governments and other public spaces have the ability to do this. They have the right and the ability to limit participation or the attendance or presence in their facility to those people who are vaccinated. And I think we have to understand that for those who have medical contract indications and can't be vaccinated, those people, should be made accommodations so that they are not discriminated against. But I think that is the most likely scenario that you'll see play out locally. More and more people, more and more businesses, more and more entertainment venues, perhaps, restricting participation to people who've been vaccinated.
Thank you. Next question is from Mo Hader.
Hi guys, can you hear me?
Go ahead.
All right. Hi, Dr. Duchin. First time meeting you. Nice to meet you. I wanted to know, with the rise of the Delta variant, the rapid spread, what does this mean for the residents of King County? And, is there a plan or a strategy in place as of now to hopefully combat this?
Well, yeah, I sort of had intended my previous comments to characterize what the impact of Delta means on the county, but just summarizing in a nutshell. By the way, welcome to the briefing. It's a pleasure to have you join us.
Thank you.
This variant is, as I said, thrown us a real curveball and is posing new challenges that we had hoped we wouldn't have to grapple with at this point in the outbreak. It's much more highly contagious. It's infecting more people more rapidly, predominantly those who are unvaccinated, but also in a small proportion of cases is causing infection even among vaccinated people who can also, in some cases, spread it to others. So what that means is we need to remember, what works in preventing COVID-19 and preventing Delta virus. Vaccination is most effective. So again, re-emphasizing the need for those who are unvaccinated currently to get vaccinated. We're doing all we can to make vaccine available and to answer questions that will allow more people who are currently hesitant or on the fence to make the right decision. Also, the mask guidance that we issued is a major step in protecting the community from getting COVID-19 personally, but also spreading it to others. And those are at high risk and can't be protected through vaccination. And we know that, relying on just unvaccinated people to mask up didn't work anywhere in the country. That way, when we can't tell who's vaccinated and who's not, basically everyone can go unmasked. And so remembering that masks work and the quality of the mask is important, and that some people may even want to use something better than a cloth face mask or a surgical mask, such as a KN95 or an N95 respirator. All these things will help reduce personal risk. But also the other strategies that are important that I'm going to speak about in my closing around remembering that, physical distancing works, that avoiding crowded indoor air spaces works, reducing contacts with others who are unvaccinated will help. And again, the critical importance of improving indoor air quality through ventilation and filtration. All of these things are part of the strategy to continue to ensure that King County remains as protected as possible from the serious surge from Delta. And right now, again, although we're seeing a spike in cases, our vaccination rates are really protecting us from a corresponding or a simultaneous spike in hospitalizations and deaths. And that's hopefully something that we'll continue to benefit from. But as I said earlier, we can't predict the future, the duration of vaccine protection, and future variants of the virus that may cause more severe illness or evade vaccine provided immunity are things that, still remain possible.
Great, thank you. We'll take a couple more questions before closing comment. So this is a question again from a community member on Facebook. You've emphasized, Dr. Duchin, the importance of ventilation indoors, and this person is wondering about the safety of hotels. Could the virus spread potentially from one room to another through ventilation systems?
Theoretically, I think that would depend on the particular facility and their air handling. And it varies tremendously from one facility to the next, how the air handling system works. In many places, each unit is independent, so there would be no safety risk in that sense. But depending on the age and design of the facility, that could vary. So I would encourage you to check with the specific facility that you might be thinking about or planning to stay in. In general, I think most of our hotels are self-contained units that wouldn't spread a viral infection from one unit to the next. Same with most of our motels. But if you have a specific place in mind, checking with them is the best thing to do.
Great, thank you. And another question from Facebook. This person is wondering about the issue of potential immunity debt in children due to lockdowns, and they're wondering about the rise of the RSV virus in various communities.
Oh, yes. So this question is about the fact that, during our stay-at-home orders and when schools are out, we saw that many viral respiratory infections, in addition to COVID, stopped circulating. And so for about a year or so, many children and adults who were not exposed to influenza viruses and other typically common respiratory viruses like respiratory syncytial virus, RSV, or parainfluenza viruses or adenoviruses. And the one that seemed most robust and able to continue to transmit better than any are the rhinoviruses, the common cold viruses. They're very hardy in the environment. They're transmitted a different way, not as much airborne perhaps. But in any case, the question then is, what does this mean as we start to gather again? Will that lack of exposure make people more susceptible to infections with these common respiratory viruses this season? I think it's a reasonable concern. I worry about that to some degree as well. And I think that there will be a significant amount of respiratory viral illness in addition to COVID this fall and winter as people start to mingle more, children go back to school. And it will make it difficult, to understand always what's causing the illness. And that's why having widely available and preferentially rapid testing will help us sort things out a bit. Particularly, we'll want to know what's COVID and what's not. And it's quite possible that we'll see, I'm sure we'll see more cases of all the respiratory viruses this coming year than we saw last year. But I'm not sure yet what the full impact of that year off, so to speak, will be on the severity or level of illness. It's possible that we'll see sort of a rebound with higher levels of non-COVID respiratory illnesses because of that year off, but I don't think that's a sure thing. We'll know in a couple of months, and I think we'll only know once we have a chance to observe what actually happens.
Thank you. And last question is a written-in question from Tony B. at Rainier Ave Radio. You've talked, Dr. Duchin, about the effectiveness of the vaccine against severe COVID illness. And Rainier Ave Radio wonders if there's any evidence about the vaccine also being more effective against long-haul COVID.
Yeah, great question. One so many people are interested in. I know right here in our community, Dr. Helen Chu at the University of Washington is studying long COVID. Certainly preventing COVID infection through vaccination is very effective, maybe 100% in preventing long COVID. If you don't get COVID infection, you're not going to get long COVID. And the way not to get COVID-19 infection is to get vaccinated. If there's, whether or not you can still get COVID-19 long haul symptoms if you have been vaccinated and get a breakthrough case is not clear. That's something that is, I think, of great interest, and people are looking into through special studies, but I can't answer that question today.
Great, thank you. And that's it for questions. So hand it to you, Dr. Duchin, for final remarks.
Okay, well, thank you everyone again for joining. This outbreak has been very challenging from the get-go, and it continues to be challenging. And there's a lot of complex information, and we really value your help in communicating with our community. The most important way to end this pandemic remains increasing vaccination coverage. It saves lives, prevents illnesses, and reduces the spread of COVID-19. And again, I urge all eligible people to get vaccinated as soon as possible to protect yourself and to protect those around you. Now, Delta has put us in a more difficult position we were not wanting to be in at this point in the outbreak. And new information has led to recent changes in indoor masking and in testing guidance. And we will need to continue to adapt to the changing reality and adjust our guidance and personal behaviors appropriately to help us stay as healthy as possible. Layered protection remains the best protection. We have great tools at our disposal to fight COVID-19. The most important are the vaccines. But again, until we're a bit further down the road and in a more stable and safer place, it makes sense to continue to take advantage of other easy and effective measures to reduce our risk. Wearing a mask in indoor public settings where not everyone is known to be vaccinated is easy and effective. It provides an extra layer of protection for all of us as we get back to doing the things we want and need to do. But remember, there are other effective strategies to prevent COVID-19, including improving indoor air quality through ventilation and filtration, through maintaining physical distance, and avoiding crowded indoor spaces that individuals can consider when they make their own personal risk decisions. But the bottom line, again, is over time, as more people are vaccinated or infected, the threat of COVID-19 will continue to recede. We will get past this. We will defeat COVID-19 largely from causing severe illness and hospitalizations, but it may take longer than many of us desire. It may take months to years, but it will continually improve over time. There remains uncertainty, right, about the future course of the pandemic. And it's not going to be a smooth ride. It's likely going to be one with continued unanticipated twists and turns and intermittent setbacks amid the overall progress. But ultimately, the threat of COVID-19, if we continue to vaccinate enough people, will recede. Thank you again for joining us, and I look forward to talking with you again.
Great. Thank you so much, Dr. Duchin, and thank you again to everyone who joined us. Reminder, you can follow our work at publichealthinsider.com and on social media at KCPubHealth. Have a good weekend.
Sheesh.
Record